So let's talk about one aspect of health that is really becoming concerning, and that has to do with self-medication, the abuse of drugs or medication, as it were. The prevalence is very high in sub-Saharan Africa, and it can actually lead to a wide range of issues. I'll outline a few of this and what it can cause, and of course, there are so many more. So if you stick around long enough, there's something you will learn. Now, self medication, as it were, which is taking drugs without consulting your doctor, is extremely common in sub Saharan Africa and, of course, around the world. A meta analysis actually showed that covering over 143,000 adolescents actually really found that roughly half of those take medications without medical advice, rising to 63% when multiple drugs are involved. And that's a high number. However, globally, 60 to 80% of adults report using over the counter products. It might feel harmless, it often isn't. So, what are the dangers, you may say? Now, the very first danger I want to speak about is wrong diagnosis, wrong drug, wrong dose. When you self diagnose, you risk choosing the wrong treatment entirely, using incorrect dosages, or masking the symptoms of a serious underlying condition. In fact, a study of 144 older adults asked to select over the counter products for hypothetical symptoms found that 79% of those made at least one type of misuse. That is wrong drug for their age, dangerous drug interactions, or a failure to follow label directions. And nearly 40% made errors in two or more categories. So in this case, what is happening is that you have someone who is continuously just taking the medication without checking how this will impact their health further. Or even if they are taking the medication, they are not even looking at the medical label specification. Some of us don't even bother to read what is written on that paper that is affixed on the medication bottle. And that can actually really become a very detrimental health issue. Number two is the adverse reactions and overdose. And what that does is this self-medication may actually lead to complicated reactions or overdose. And a systematic review actually found that among self-medicating elderly patients, the prevalence of adverse drug reactions range from about 5% to as high as 75%, which is a very large number, depending on the study. And this is actually with analgesics and anti-inflammatory drugs being the most common culprits. So therefore, over-the-counter misuse also carries real risk of dependence, and a meta-analysis actually estimated that about 16% of adults misuse over-the-counter drugs. So 2% abuse them and 7% develop dependence, most commonly with analgesics, sedative, antihistamines, and cough mixtures. So the sad reality of this is that an individual may be so attached to these medications that he or she doesn't want to let go. The third danger of self-medication, in terms of consuming it, as much as possible without, looking at what the issue can be, is antibiotic, resistance. And this, I want to speak about this because of my experience in the laboratory. Self-medication with antibiotics is a major driver of antimicrobial, resistance. And a systematic review estimated that a global prevalence of antibiotic self medication at about 28%, with rates as high as 82% in some low and middle income countries where penicillins are most commonly self administered, often for respiratory infections that don't even require antibiotics, can actually fuel, resistant bacterial strains that threaten everyone. And in fact, when your samples are sent to the lab for testing, you might just be creating more problems for the guy who is that laboratory personnel handling your sample, in the lab. So the message is straightforward. Before you consume a flurry or a whole number of medications, please do me a favor. Can you consult your health professional? Or could you actually read your labels carefully? And besides, never you even go ahead to begin to reuse old prescriptions for new symptoms that you know nothing about. And please, I'm begging you, never share, your antibiotics. But at the bottom end and at the end of the whole conversation, please do the world a good service in finding out from your healthcare professional or the person that is assisting you with your condition, so that we can also have a better world in terms of not having, health situations that can spiral, out of control. I do hope that this session, makes meaning to you, and I hope that we can make some corrections going forward. Thank you so very much. If you do find this conversation useful, please subscribe for more because I'll be talking more on other health, related, conversations. And maybe the next time we will bring someone also to share an idea with you. God bless. I'll see you on the next one.